It's my honor to be here to talk about our pulmonary artery denervation for pulmonary hypertension. Maybe it's very different from cardiomyopathy, but today I will answer your three questions. First, why we do pulmonary artery denervation. As we know, in pulmonary hypertension, the systolic and local sympathetic nerves activity leads to the RV remodeling and the more severe pulmonary ventricular remodeling. So our technique invented by my boss, Professor Shaoliang Chen, he invented this therapy. It's an invasive therapy for pulmonary hypertension. We use the special catheter from the inside of the pulmonary artery to destroy the nearby pulmonary nerve around the pulmonary artery. So our clinical results showed that after pulmonary denervation, the patients could benefit from 6-minute walk distance and decreased of the NT-proBNP and the decreasement of the PVR. And also the clinical worsening was decreased significantly. So over the past decade, from animal studies to clinical trials, we showed a solid evidence-based foundation. Firstly, we have two kind of animal tests to explore the mechanism of the pulmonary denervation. And then we have the first in-man study to show the feasibility and the safety of our pulmonary denervation. Then we have two RCT clinical trial. The first was the PADN5 study to focus on group 2 pulmonary hypertension. That is the group that is the CPCPH, and another RCT was for group 1 pulmonary artery. That's for 128 patients. So actually, in the past years, our pulmonary denervation was recommended in Chinese guideline and also in 2022 ESC guideline, and also we published our Chinese consensus and Chinese expert advisory in the 2 last years. And also in 2023, the China NMPA approved our commercial application, and this year the Europe CE mark approved our pulmonary denervation technique for group 1 pulmonary hypertension. And then who would benefit from our pulmonary denervation? As I said, we have two clinical trial, RCT clinical trial. One is for the group 1 pulmonary artery hypertension, and this trial included 128 patients who was diagnosed as group 1 pulmonary hypertension, and they were divided into 2 groups at 1:1 ratio. And we can see at the 6 months after pulmonary artery denervation, the 6-minute walk distance increased from baseline to by 56 meters in PADN group, and in CM group, the 6-minute walk distance only increased 26 meters. So PADN significantly improved the 6-minute walk distance at 6 months. Also, we can see at 1 year after pulmonary denervation, the mean 6-minute walk distance increased consistently to by 52 meters, and the sham group didn't show any increase. So it also significantly improved at 1 year. And also from this chart, we can see the PVR at the 6 months. The PADN group showed significant improvement, and the NT-proBNP showed the significant decrease in PADN group. And we can see the clinical worsening was less in PADN group, both at the 6 months and at the 1 year after pulmonary denervation. Actually, at the 1 year after pulmonary denervation, PADN group occurred in 3 patients, and the sham group occurred in about 15 patients. So clinical worsening was decreased in pulmonary artery group. And this is for the group 1 pulmonary hypertension. Then we move to the group 2 hypertension. We know in heart failure or cardiomyopathy, the left heart disease could increase the pulmonary hypertension and lead to the severe right heart failure. So we can see many left heart disease caused secondary pulmonary hypertension, and some patients was diagnosed with composed pre and post capillary pulmonary hypertension due to the venous and artery remodeling. So our clinical trial, this RCT trial, included the CPC-PH. Totally 98 patients was included in our PADN-5 study. And we can see from this chart the hemodynamics at 6 months in the sham group, that's the sildenafil group. The hemodynamic didn't change anymore. That's the same as the baseline. But however, in the PADN group, we can see the significant improvement in our PADN patients, and it shows the systolic pulmonary artery pressure decreased, and the mean pulmonary artery pressure decreased, and the PVR decreased. So the hemodynamics at 6 months, we can see its improvement. And also the NT-proBNP showed the significant decreased at 6 months, both at 6 months and 3-year follow-up in PADN group, but in sham group there's no change. And also the 6-minute walk distance at 6 months, the PADN group showed significant increasement, and the at the 3-year we can see the significant increase of the 6-minute walk distance. And let's look at the clinical worsening. And our clinical worsening means the combined with the rehospitalization, cardiac death, and all-cause death. So we can see the clinical worsening. Our pulmonary artery denervation group showed decreasement, the benefit from the pulmonary denervation, both at the 6 months or at 1 year or at the 3-year. But separately, we can see all the benefits comes from the decreasement of the rehospitalization. Actually, all-cause deaths didn't change and, in the two group. Actually, for the Group 2 pulmonary hypertension clinical trial, we finished our pulmonary artery denervation 5 trial, and we have 3 trial ongoing. One is the PADN-HF PH trial. This trial include over 200 patients in China, and now we finished the enrollment and wait for the follow-up results. And also we have our pulmonary Columbia trial in Europe and Singapore, Malaysia, Georgia, so many other countries. And all the patients include 30 patients. And also we successfully be proved a new trial in US that's named the PADN IDE. So maybe next year we could perform our PADN IDE trial in Europe and US. That's a big clinical trial. So this is our pulmonary denervation global navigation. This shows we did this this performation in other countries, including Portugal and other Georgia or in Italian and other countries. And next, I will talk about how to do the pulmonary denervation. Actually, this performance is very simple. Just firstly, do the right heart catheterization, and then we do the pulmonary angiography, and then we deliver the pulmonary denervation catheter in the pulmonary artery, and then we ablation, and then we rechecked the right heart catheterization. So actually, in our country or other country, doctors says it's a very simple perform. So let me show you the pulmonary angiography. We need 2 positions. One is the LL 20 degree and crayon 20 degree, and another is crayon 20 degree to show the pulmonary artery directly. And then we should measure the diameter of the pulmonary artery to choose different catheter. And our catheter diameter was suggested to be 1:1 and 1.2 to 1 of the pulmonary artery diameter. So I mean, this patient, the diameter was about 36 millimeters. So we could choose our catheter. The diameter was about 40 millimeters. And the ablation size showed in the right picture. We need to ablate the point A, B, and C, the 3 points. So how to choose the ablation size is very important. Simply say is that in the left ostium of the left pulmonary artery and the distal of the main pulmonary artery, it shows in the A, B, C, the 3 points of this circle. So actually we don't do all the 3 circle, but just half the circle in the pulmonary artery. And this is the patient. We deliver the pulmonary denervation catheter and rotate it in the pulmonary artery, and we put the circle in the ablation sites, and we choose different sites to ablate one by one. And this patient, we can see the follow-up results, the increasement of the NT-proBNP and the increasement of 6-minute walk distance, and the benefit from the WHO class. And also we can see the hemodynamics of this patient showed very significant increasement from baseline mean pulmonary artery pressure 55, very high, and 6 months later decreased to 28 millimeters of mercury. So we think this patient benefit from our pulmonary artery denervation. And in conclusion, in the past 10 years, we have some clinical trial to prove the safety and the feasibility of our pulmonary artery denervation. And also we have ongoing clinical trial to show more evidence of our benefits. It could maybe we can see more evidence. Thank you so much.